The story of the $300 million Medicaid mix-up is not simply about misplaced figures in a ledger. It is about lives, trust, and the integrity of a system designed to care for the most vulnerable among us. Medicaid was built as a lifeline, ensuring that families without means would not be left without care. Every dollar allocated carries a weight far beyond its monetary value. It represents a doctor's visit for a sick child, medication for a struggling parent, or treatment for an elder who cannot afford it otherwise. When such a staggering sum is misused, the loss reverberates across communities. It means appointments delayed, prescriptions skipped, and health outcomes jeopardized. For the individuals who rely on Medicaid, the difference is not measured in billions or millions, but in whether they can access care when they need it. The mismanagement of resources meant to save lives erodes faith in the very institutions tasked with protecting them. The issue also shines a spotlight on oversight and accountability. Systems of checks and balances exist precisely to prevent waste, fraud, or negligence of this magnitude. Yet the breach in stewardship shows that loopholes remain, leaving room for exploitation. If hundreds of millions can be diverted without swift detection, then questions must be asked about how safeguards failed, who is watching, and what reforms are urgently needed. Beyond the dollars and audits, this incident forces us to reckon with a deeper truth. Public trust is fragile. Communities contribute to and depend on Medicaid believing it will be used wisely, not squandered or misdirected. To betray that trust is to weaken the bond between people and the systems meant to serve them, a bond that, once broken, demands far more effort to restore than it did to create. The $300 million Medicaid mix-up is not just a matter of numbers on a spreadsheet. It represents an immeasurable loss to the people who depend on the program for survival. Each dollar in Medicaid is meant to serve a purpose far more profound than financial exchange. It stands for medical visits that catch illnesses early, prescription medications that control chronic conditions, or therapies that allow individuals to live with dignity. When such funds are misused or diverted, the immediate consequence is that someone, somewhere, is denied care they should have received. A missed appointment could mean a disease goes undiagnosed until it is too advanced. A skipped prescription could mean a relapse, and a delayed procedure could turn into an emergency. The human cost of this mismanagement is felt most deeply in households already living on the edge. Families who rely on Medicaid do so because they cannot afford alternative options. For them, health coverage is not an extra. It is the only lifeline ensuring access to treatment. When resources intended for them are squandered, the burden shifts back onto people who have the least capacity to shoulder it. Parents face agonizing decisions about whether to pay rent or pay out of pocket for medical care. Seniors stretch prescriptions to last longer than prescribed, and children suffer from untreated conditions that compromise their futures. Behind every misallocated dollar lies a story of suffering that might have been avoided. The magnitude of $300 million means countless such stories, multiplied across states, communities, and families. While statistics can make the problem feel abstract, the reality is deeply personal. The absence of those funds translates directly into lost opportunities for healing, for stability, and for dignity in the lives of those who needed support. Most $300 million cannot be dismissed as a minor oversight or a bookkeeping slip. It represents a scale of mismanagement so vast that it reshapes the very conversation around healthcare funding and public accountability. Such a figure is not hidden in a corner of a budget. It is a gaping hole that impacts the allocation of resources across entire programs. The sheer size of the loss forces recognition that this is not the failure of one individual task, but a systemic problem that went unnoticed until the damage had already been done. When money of this magnitude disappears or is misused, the implications ripple far beyond the immediate shortfall. Budgets that should have been directed toward hospitals, clinics, and providers are suddenly constrained. Entire programs may face cutbacks, reducing services or delaying much-needed expansions. The scale of 300 million also sends a message to taxpayers and recipients alike that the system can falter at levels no one imagined possible. It prompts questions about whether similar problems lurk undiscovered, waiting to surface only when the losses grow too large to ignore. The significance of the figure is not only financial but symbolic. Large numbers capture attention, but they also carry weight in the public mind, shaping perception of competence, credibility, and safety. A sum this large undermines confidence in whether resources are being properly managed at all, casting doubt over future allocations and threatening the stability of programs that depend on consistent support. Each misplaced million erodes the foundation of trust, and when hundreds are involved, it magnifies into a crisis of faith in the system itself. The scale becomes proof that what is at stake is not a single incident but a structural vulnerability that must be reckoned with. The communities most impacted by the $300 million Medicaid mix-up are the ones least able to absorb the shock. Medicaid exists to bridge the gap for those who cannot afford private insurance or consistent access to healthcare. It is designed for families balancing multiple jobs, seniors living on fixed incomes, and children whose futures depend on early and reliable treatment. When such a significant amount of funding is mishandled, it is these groups who feel the consequences first and most severely. The safety net weakens, and the very people who rely on it to catch them are left exposed to risks they cannot manage on their own. For children, the effects are particularly harsh. Missed vaccinations, untreated chronic conditions, or delays in specialist care can create long-term health challenges that shape their entire lives. Seniors, many of whom depend on Medicaid for prescriptions, home health aides, or critical procedures, face impossible choices between rationing medication and meeting daily living expenses. Low-income adults, already struggling with instability, may postpone necessary medical visits, leading to conditions worsening until they become emergencies, costing even more in the long run. The weight of this mismanagement is not only physical but psychological. Vulnerable communities often live with a constant undercurrent of worry, and when they see the very system meant to protect them falter, the stress compounds. It becomes harder to trust that assistance will be there when needed, harder to believe that promises of care are more than words on paper. The mix-up strips away a sense of security, replacing it with doubt and fear, leaving those who already carry the heaviest burdens forced to navigate an even harsher reality without the support they were told they could depend on. The $300 million Medicaid mix-up highlights glaring weaknesses in oversight and accountability that should never have been allowed to persist. Systems that handle public funds are expected to be fortified with safeguards, checks, and continuous audits. Yet the loss of such a massive sum reveals that these measures were either inadequate or inconsistently applied. Oversight is meant to function as a safety net, catching irregularities before they spiral into crises. But in this case, the holes in that net were wide enough for hundreds of millions to slip through undetected. Accountability extends beyond the technical mechanisms of audits and compliance reports. It also requires a culture of responsibility, where leaders understand that the resources entrusted to them are not abstract numbers but lifelines for real people. When accountability is weak, mismanagement can flourish unnoticed, and mistakes can escalate into systemic failures. The absence of swift detection in this case suggests that either warning signs were overlooked or that those tasked with monitoring lacked the tools, training, or authority to act decisively. The incident also raises questions about transparency. Public programs are funded by taxpayers and exist to serve communities. Yet the flow of information about how funds are used often remains inaccessible or delayed. Greater transparency could have illuminated discrepancies earlier, allowing corrective action before the scale became catastrophic. Instead, the lack of visible accountability left room for the mismanagement to grow unchecked. This mix-up demonstrates that oversight cannot be treated as a formality, ticked off in reports or annual reviews. It must be dynamic, proactive, and relentless, adapting to the complexity and scale of the funds being managed. Without rigorous accountability, even the most well-intentioned systems are vulnerable to the kind of failures that undermine both financial stability and public trust. Public trust is one of the most fragile yet essential elements in the functioning of any healthcare program, and the $300 million Medicaid mix-up struck directly at its core. Communities rely on the assurance that funds dedicated to their well-being are managed with precision, integrity, and care. When that assurance is broken, it casts a shadow not only over the incident itself, but over the entire system designed to protect society's most vulnerable. Trust, once shaken, is not easily rebuilt, and every mismanaged dollar deepens the sense of doubt among those who depend on the program the most. For many, Medicaid is not simply a policy line item but a promise, an understanding that when illness strikes or when financial hardship prevents access to care, there will be support. When such a massive sum is misused, that promise appears hollow. People begin to wonder if the safety net is strong enough to catch them, or if it will unravel when they need it most. This erosion of trust has consequences beyond the immediate breach. It influences how communities engage with healthcare, whether they feel confident seeking help, and whether they continue to believe in the fairness of public institutions. The ripple effects extend even further into the relationship between taxpayers and government programs. Those who contribute expect transparency and responsible stewardship, and when they see evidence of large-scale mismanagement, skepticism grows. That skepticism can fuel resistance to future funding, weakening support for programs that, despite their flaws, remain lifelines for millions. Each breach of trust chips away at the collective confidence required to sustain large-scale healthcare systems, leaving behind doubt, resentment, and reluctance to invest in the very programs designed to ensure that no one is left behind when care is needed most. The $300 million Medicaid mix-up underscores the urgent need for reform and vigilance in the management of public funds. Safeguards cannot be seen as optional or secondary. They must be central to every decision, every process, and every layer of oversight. Stronger systems of auditing, real-time monitoring, and transparent reporting are essential to prevent similar crises in the future. Without structural reform, the vulnerabilities that allowed this incident to happen remain in place, waiting to be exploited again. Reform is not simply about closing a loophole, but about creating a culture where every dollar is accounted for with the seriousness it deserves. Vigilance must become a continuous process, not a reactive measure taken only after a problem is discovered. Cybersecurity protections, independent audits, and rigorous staff training are not luxuries but necessities for any institution managing billions in healthcare funding. The mix-up revealed what happens when vigilance wanes, when assumptions about security replace active scrutiny. In a system as vast as Medicaid, complacency becomes an open invitation to error, waste, or abuse. Equally important is the role of transparency in reform. Communities have the right to know how funds are used, and clear reporting fosters accountability. By making information accessible, institutions not only deter misconduct but also rebuild public confidence in their stewardship. Reform cannot succeed without trust, and vigilance cannot be sustained without openness. The mix-up is a reminder that prevention is far less costly, both financially and socially, than recovery after the damage has been done. It shows that reform is not a one-time act but an ongoing responsibility, and vigilance is not a temporary state but a permanent obligation to those who depend on the system for their health and dignity. The mix-up is a reminder that prevention is far less costly, both financially and socially, than recovery after the damage has been done. It shows that reform is not a one-time act but an ongoing responsibility, and vigilance is not a temporary state but a permanent obligation to those who depend on the system for their health and dignity. The final question that lingers is clear: if $300 million can vanish so easily, how much longer can we afford to wait before true accountability takes hold?